free services to help tackle childhood obesity in the capital will be rolled out across the boroughs of Hammersmith, Fulham, Kensington and Chelsea and Westminster. Healthy lifestyle social enterprise Mytime Active will deliver a service called MEND, which stands for Mind, Exercise, Nutrition, Do It. Well, Chief Research and Development Officer of MEND, Dr. Paul Sasha, joined me a little earlier on to explain more.
We have roughly sort of 1 in 3 children are overweight or obese. And this problem has been a serious problem for quite a while now, and various initiatives have been put into place over the years. However, by far, this is kind of the most aligned and integrated approach to kind of tackle obesity that's been put into place, where the 3 boroughs are coming together and actually implementing what we call a whole systems approach. So we're looking at implementing programs in schools, nurseries, children's centres, the workforce, and right across all different levels of society to really try and bring down some of these worrying obesity rates that we're seeing in the capital.
When you're saying you're engaging all those different areas, how? What are you asking them to do?
So we're training a whole raft of different sort of professionals, physical activity specialists, dietitians, nutritionists, to actually go in and work with families in local areas. So we're training up the workforce in these areas to actually start tackling the problem in their own communities.
So is it about education then?
The programs work on different levels. There's a very strong sort of physical activity or exercise component, so we actually get children and parents engaged and physically active, but not boot camp style, doing fun-based physical activities, also helping to improve children's balance, skills, agility, coordination, all those types of things. We then focus on nutrition, teaching families how to make healthy choices, how to eat healthy on a budget, very simple things that they might not have known before. And then we really work on behavior change, so giving parents strategies to actually change their own children's behavior when it comes to healthy eating and physical activity.
Why do we think then that London is the worst of the country in terms of obesity levels?
Typically you see within sort of urban areas that obesity rates are generally higher, and there's many different reasons for that. Obesity is very strongly linked to socio-demographics, so where you see people from more lower socioeconomic circumstances and also some families from ethnic backgrounds, you do tend to see more issues when it comes to obesity.
Now, how long is this programme going to last, and are there plans then to roll it out further?
So at the moment, this is a 3-year contract that Mytime Active has to really embed itself within these communities, but very much using local professionals to deliver the services. Hopefully this will continue. We will see positive results. MEND has fantastic research results internationally. It's running in 5 countries, and it's the most researched and evaluated program internationally, and we see very positive results from the program in many other areas. MEND has also run across London since 2006, so we have a lot of good evidence showing that MEND does work in Hammersmith and Fulham and other boroughs across the capital as well.
So you already have existing results from London work?
Yeah, so we've done a randomised controlled trial at UCL. We also did a study where we followed families up for 2.5 years after the programs, and we saw that more than 50% of the children had actually maintained or reduced their BMI Z-score, which is basically their weight status. So we saw positive results 2.5 years after the programs, which is really positive.